Hi, I'm Dr. Paul, and thank you for watching this video from Waterfront Dentistry by Paul's. Today, I'd like to talk to you a little bit about how our office takes care of children and making sure that pretty much every child is taken care of as far as cavities go, but more importantly is try to be given a good experience, and that translates into not having a psychological scar, which prevents them from not attending dental clinics as often, and even come as an adult, don't have as many anxiety or as many bad baggage as a lot of us used to have back in the day. Now, you need to understand the importance of baby teeth. So I've actually made a video about baby teeth, how they come in, when they're supposed to come in, and what the importance is. But to sum it up, baby teeth are nature's space maintainers. If you don't have baby teeth that are healthy, if you don't have baby teeth that are keeping the spaces patent, then you will have far more complications as an adult, with a lack of spacing, with crowding, with expensive orthodontic treatment. And also you might have situations where your permanent teeth have come in with problems because of abscesses from the baby tooth. So it's really important to keep your baby teeth as clean as possible, or a child's baby teeth as clean as possible and as pathology free as possible. But more importantly, what's even more important is to realize that there's actually a child attached to that tooth, which means it's really important not to psychologically scar them. So there's a study that actually states that kids below the age of 7, they can't quantify pain, which means if you ask them, was the experience stressful or painful, they actually don't know the difference between stress and pain, and they relate stresses to pain. Now, this is hugely important, because most of the kids that come into our practice, either they have really good teeth with barely any cavities, or they have a lot of cavities going on. And what we've decided to do is take an approach of staged care, and we'll talk a little bit more about this. So let's talk about how we handle a situation where it comes when a parent brings a child in. So right off the bat, the first thing we tell them, or we tell any of our clients who are expecting, is that the first time to bring the child in is before their first birthday. Now, this is important because there's something called vertical transmission. So a child actually gets the pathogens of the bacteria that cause decay from mom, dad, or caregiver. It's called vertical transmission or inoculation. And we know this for a fact because when you actually do a genotype match, which means you're matching the bacteria, there's a 100% match positive, or a positive match between the bacteria in mom, dad, or caregiver's mouth and the baby's, or the child's bacteria in the child's mouth. So this is the reason why it's super important for us to address this issue before the child's first tooth even comes in. Now, there's actually been a 2013 report from the Canadian Institute of Health Information stating that the number one reason for a child below the age of 5 to get general anesthesia is actually from dental disease, or to fix dental disease. Now, think about that for a minute. So ORs, or operatory rooms, are actually handling more dental related stuff than ever before. And they've actually given dentists more OR time. But unfortunately, the more OR time the dentist or the staff have gotten, the more number of patients or kids actually have decay. So fundamentally, no one's actually addressed how to nip things in the bud, right? So this is the reason why it's super important to take an approach wherein not only are you treating acute problems, not only are you preventing chronic problems, but right now us dental professionals are in the third era where we're coming up with this holistic approach of how to incorporate behavioral and biological ways of preventing cavities and taking it one step further. So what that basically translates into is these kids, once they become healthy adults, they won't have needs for root canals, crowns, bridges, implants, and pretty much everything expensive. So it's a really new way of coming up with an approach where a person's tooth, from the fact that this person was a child, is addressed right from the get-go. Now, let's talk about the instance where in Ottawa, for example, if you're over the age of 6, you don't get to go to a government-funded operatory room to have fillings taken care of, which means there's a lot of expense where the parent has to pay for all the stuff at home. So again, using a staged care approach. So let's talk about a staged care approach. So the first thing is using procedures in order of complexity, starting from the least complex to the most complex. So when a child comes in, you start putting in stuff wherein you're not really being, or the dentist isn't being invasive in the sense, needles and drills, but actually using stuff or materials that can slow the progression or stop the progression. Which brings me down to the second point of staged approach, is using bio-inert materials like certain lacquers or varnishers or solutions that actually stop cavities from progressing. And this lets the patient or the child grow older while constantly coming into the dental operatory and seeing the same person or the same hygienist, and then developing a trust wherein we can actually do more definitive work. The third, of course, is using something called conscious sedation, which is something we don't use too often if we use the staged approach effectively. Now, kids in rural settings actually have 3 times more risk of getting decay, and kids from Aboriginal areas actually have 10 times more. So the whole concept of taking care of one's baby tooth is important now more than ever, because the dental insurance or the dental economy that's being implemented is getting to be more and more expensive, because all the consequential treatments like crowns, bridges, root canals, implants, single implants, multiple implants, all these things are costing a lot of people billions, even trillions of dollars. But if we actually come up with a way to fix this before it even starts, that's the golden ticket, right? So now let's talk about behavior modification. So if a mom or dad or a health or a family unit understands that before the child's tooth first comes in, making sure that there's the least amount of pathogens in the mom, dad, or caregiver's mouth, the better. Because no one realizes it, but you're actually transmitting the bacteria from yourself to your child. Till the age of 1, having breast milk is a really, really good scientifically proven modality of transmitting not only nurture but also antibodies and immune system reinforcing modalities from the mother to the child. It also accelerates brain development. It's got a lot of benefits. But after the first age, the likelihood of this child getting cavities is much more if the child is still breastfed. Now, it's nothing from the breast milk itself, but it's also the fact that other carbohydrates are being given to this child. And after the first tooth comes out, nothing, and I can't stress this enough, nothing but water for this child. Right? So now let's come up with a staged approach of how we deal with these kids. So in the next couple of videos, I'll talk to you about special varnishes, lacquers, and solutions that we're implementing from a pediatric standpoint. And this actually lets people or children not need to go to an OR or have a sleep dentistry, or even put to sleep for that matter. Now, you got to realize that as of now, there's a 12-month waiting period for any child to actually be put under to have any dental work done through general anesthesia. So there's also a 2007 study out of NIHANS, and what that study basically says is if a 2-year-old, actually a 3-year-old, is given general anesthesia for more than 2 hours, there's a high chances that there might be brain or developmental deficiency of the central nervous system. Now that's huge, because once a child is put under GA, it takes at least 2.5 to 3 hours for us to pretty much take care of all the fillings. And also don't forget that once you do the fillings, this child now has a higher risk of getting more cavities, because all you're doing is you've plugged up holes, but you haven't changed the behavioral route from the child or from the parents to make sure that this pathology or these cavities don't come back again. So have a look at the next couple of videos, because this is basically how we end up seeing each and every child in my dental office, and we try to reduce referring them to places where they can be put to sleep by approaching this through a staged manner. Thank you so much for watching.